In the last video, we reviewed the difference between evidence-based and promising practices, as well as individual and environmental strategies. So, you should be ready to dig in a little deeper in this training segment as we look at the 60 strategies of AIM. When you look at the Project AIM website, you will see that both the individual and environmental strategies are evaluated on the following criteria: higher effectiveness, moderate effectiveness, lower effectiveness, not effective, or too few studies to verify effectiveness. Strategies are also divided into costs: higher costs, mid-range costs, and lower costs. As a review, individual strategies aim to produce changes in attitudes or behaviors about alcohol use in a person rather than the environments in which alcohol use occurs. Using an individual strategy, you would expect a person's alcohol use to decrease, risky behavior to decrease, and so health and other outcomes to increase or improve. Let's look at some of the individual strategies that are rated as higher effectiveness. And don't forget to click the link on the notes and resources under each strategy listed for more information. It's not a stretch of the imagination to say that not every campus has a large budget to address alcohol use. But the good news is that there are effective strategies that don't cost that much, if anything, to implement. The first group of strategies we will look at is higher effectiveness and lower costs. Let's talk about normative education or re-education through use of a personalized normative feedback form, or PNF or PFI, personal feedback intervention. This is rated as higher effectiveness and lower cost, which is a win-win. Because these are completed online, the cost for implementing and analyzing the PNF is low since the students take the assessment on their own. All you really need is a person to coordinate. That person could be you or someone in your department or office, or even an intern or a graduate student. You are probably already familiar with some of the PNFs available and may already be using one: eChug, eCheckup to Go, Basics, and others. And the good news is that ICAN is working to develop an Indiana specific PNF that hopefully will be ready to use in 2023 and will be a low cost tool. Skills training centered on alcohol includes self monitoring, self assessment approaches, and involve repeated assessment, daily diary, multiple longitudinal assessment spread out over weeks, months, or years without any other intervention. The next group of strategies is higher effectiveness, mid range costs. These include skills training with goal and intervention setting, general skills with life skills, brief motivational interviewing, and other PFI forms. These require more coordination from staff since strategies like BMI involve analyzing the students' responses and offering them personalized feedback on their alcohol use, risk, expectancies, perceptions of social norms, and options for reducing problems and consequences. Discussions are guided by a trained facilitator, and goals for behavioral change are set by the student. The last individual higher effectiveness strategy also costs the most: higher effectiveness, higher cost. That is a multi component education focused program, or MCEFP, like Alcohol EDU. Alcohol EDU for college is a two-part online program providing personalized feedback along with education around alcohol use. The first part of the program is typically completed in the summer before freshmen arrive on campus, with the second part being completed during the fall. The cost depends on the size of the cohort participating, but can be quite expensive. Now let's take a look at moderate effectiveness strategies, which have been shown to have some impact on individual attitudes and behaviors. The lower cost strategies are skills training that allows students to weigh the pros and cons of their drinking or simply educate about the impact of alcohol without any other interventions. More mid range cost strategies include general skills training with expectancy challenge interventions like Alcohol 101 and VMI, or MCEPF, with no other intervention or strategies. There are no strategies that are higher costs. We caution your use of the next strategies, which are lower effectiveness and not effective. If you are currently using any of these strategies, That is okay, but you should take a look again at your campus data to identify the biggest alcohol related challenges. While using lower effectiveness and not effective strategies isn't necessarily bad for your campus, if you want to have measurable outcomes, these would need to be paired with higher effectiveness strategies. The lower effectiveness or not effective strategies include normative education without any other intervention. An example would be a 21 birthday card or mock car crashes. Skill training with no other strategy or intervention. An example would be the free web based Alcohol 101 Plus, which provides alcohol education on a virtual campus modeling potential drinking scenarios. Not effective is alcohol education that is only a discussion with no other intervention or strategy, values clarification alone, and skills training alone, such as a BAC feedback tool. Project AIM also includes some strategies that are still in the promising practice stage but don't yet have enough data or replication to be ranked as effective or evidence based strategies. These include PFIs, Check Your Drinking, College Drinkers Checkup, CDCU, and Drinking Assessment and Feedback Tool for college students. Strategies that were not rated by Project AIM but can reduce harmful drinking in the general adult population and can be applicable to college age students, screening and behavioral treatments, and medications for alcohol use disorder. That's a lot of information on individual strategies, but don't worry, you can go to the link below to review them and also get more information on the resources available. Now let's look at environmental strategies. As you learned in the last video, environmental strategies aim to change the alcohol use environment in the campus, community, or both, and thus can affect the student body as a whole or in large subgroups such as those under age 19. Most of the environmental level strategies on the Project AIM website seek to reduce alcohol availability, one of the most effective ways to decrease alcohol use and related problems. Some of these strategies can be implemented on the campus or in the community, and some must be passed through legislation at the state level. And as we look at state level legislation, you can still be involved. As someone who works with college students daily and understands the impacts of alcohol, you can testify in committee as an expert witness, submit testimony in writing, and educate your state legislators. As a citizen, you can do all these things without worrying if you are violating your campus policy on lobbying. Let's start with these higher effectiveness and lower cost environmental strategies, and we will indicate which ones are state level legislation strategies. Restricting happy hours is a state level strategy. Indiana law does not allow happy hours, which is good news. The not so good news is that the law does allow low drink prices as long as they're at the same price the entire day. 21-year-old drinking age is a state strategy. There have been some efforts in the past few years to lower the drinking age to 18 because we know about brain development and that our brains aren't developed until we're in our mid 20s, 25 to 27. Lowering the drinking age is not a safe or healthy approach to alcohol. Restrict hours of alcohol sale is a state level strategy. Currently, alcohol can be purchased and consumed between the hours of 7 a.m. to 3 a.m., meaning that there are only 4 hours in which alcohol cannot be purchased and consumed. Some would like to see these hours be 24 hours a day, which would increase alcohol related harms, not a safe or healthy approach to alcohol. Ban on Sunday sales of alcohol is a state level strategy. Indiana did have a ban on Sunday sales until 2018 when the law was changed to allow alcohol purchases for carryout between 12 and 8 p.m. Social host law is a state level strategy. The Indiana Coalition to Reduce Underage Drinking worked to pass this into law in 2014. This law holds adults responsible for providing a place for minors to drink. Within the higher effectiveness and moderate cost categories, there are other policies that can be enacted. Conducting alcohol compliance checks is a state level strategy. This law enforcement activity uses minors to see if they can purchase alcohol in a retail establishment. Minimum pricing for alcohol is a state, campus, or community level strategy. This strategy allows retailers to set their prices for alcohol not going below a certain amount. Higher alcohol prices can reduce high risk drinking among youth and adults. Increasing the alcohol tax is a state level strategy. Indiana has not seen an alcohol tax increase since 1981. This strategy empirically confirms that increasing alcohol taxes reduces youth and adult high risk drinking. Dram shop liability is a state level strategy. This policy holds accountable any retail establishment which overserves an adult or serves a minor and that service results in an injury or death. Fake ID laws is a state level strategy. It is a felony to use a fake ID, including for the purchase of alcohol. Responsible beverage service is a state, campus, or community level strategy. In Indiana, persons who serve alcohol at a restaurant or sell it at a liquor store are required to receive training as part of their permit process. However, those who sell alcohol at a grocery, convenience, drug, or big box store do not. RBS covers topics such as alcohol laws, how to card, and how to refuse service. Keg registration is a state level strategy. The Indiana Coalition to Reduce Underage Drinking worked to pass this law in 2012. This law requires anyone purchasing a keg to provide their contact information and information about where the keg will be used. Keg registration laws have been proven to reduce underage drinking. What can be done on campuses? Let's look at some additional policies. Campuses can prohibit alcohol sales and use on campus and at sporting events. They can restrict alcohol advertising and sponsorships on campus, though this is a tough one because the alcohol industry has a lot of money and are eager to provide sponsorships. Limit outlet density. This state and local policy allows for limiting of how many places that can sell alcohol in a given geographical area. Data shows that the greater the alcohol outlet density, the higher the rates of crime, alcohol related injuries, and increased calls for service from first responders. You can conduct mystery shopper visits. Like compliance checks, these campus community surveys are implemented to determine if retailers are selling alcohol to minors. But instead of minors conducting the checks as if the law enforcement details, these checks use students at least 21 years of age. Here is something to think about. On your campus, where is alcohol sold? What about sporting events? Can patrons and students drink alcohol on campus? And how many outlets are on or near your campus? Less effective strategies for campuses include creating an alcohol free campus and implementing a social norms campaign with no other strategies. There are several other strategies that you may have implemented or have thought about implementing, but don't have enough data or replication or have mixed results, or are not effective on their own, but maybe when paired with higher effective strategies, like prohibiting alcohol on campus events, alcohol amnesty policies, Friday morning classes, substance free housing, campus party patrols, noisy assembly ordinances, prohibiting kegs, green dot or other bystander intervention training, safe ride programs, or unique ID card design for under 21. Phew, we made it through the 60 AIM policies. As always, please go to the website below to review these policies and resources. Next time, we will look at the worksheet tool, and using the matrices, you will be able to identify current strategies you may be using on campus, and you'll be able to list possible new strategies that you can use, including cost, effectiveness, and barriers. This worksheet will be a great tool as you examine what you are currently doing and if you can be doing anything else to address alcohol related issues. Don't forget to click the link in the video description to take the brief evaluation. Everyone completing the complete training series on Project AIM will have the chance to receive an incentive for participation. Until next time, thanks for all you do to keep students healthy and safe on campus.